The meeting. First item.
Thank you, Chair Pranger. So looking for approval of the agenda, and late items.
Do I, Director Popoff, Director Robb, those in favor, contrary, carried.
Next item is 3.1. We have the draft Hospital District Capital Project Working Group meeting minutes of November 22nd, 2021.
Do I have a mover? Director Dickey and Director Stobart. Any errors or omissions? Those in favor, contrary, carried. Thank you. And next item.
Next item is 4.1, which is the Regional Health Needs Assessment. And it's a brief presentation. I'll just ask staff to put the PowerPoint up on the screen. Thank you. So as the working group will recall, back in July 2021, the hospital district directed staff to bring back a report about the possibility of the hospital district undertaking a regional health needs assessment. So this presentation will outline the research undertaken to date and seeks the working group's direction for next steps. Next slide. So first, what exactly is a regional health needs assessment? And really, that name could mean many different things to many different people. Generally speaking, the purpose of a health needs assessment is to collect, analyze, and present the information required to plan for health services that are needed to improve the health of a specified population. It provides baseline information about the health status of various populations. It helps us understand what health services the population uses, where they access services and why they use them. And it identifies opportunities for disease and injury prevention, health promotion, and health protection strategies. It also incorporates evidence-based decision-making in priority setting and planning. Next slide, please. That's okay. Thanks. So as I understand it, the hospital district's goal in exploring a regional health needs assessment is to allow the hospital district to define the needs of its population and to develop long-term evidence-based strategies that would assist Fraser Health Authority in improving community health in any of the areas that might be identified. It's also an opportunity for the hospital district to identify to the health authority what health services it sees are missing, where there are gaps in services, where additional services are needed, and what the key health priorities are for the region. Next slide, please. So like any health needs assessment, whether it's big or small, it needs a structure or a framework. And the 4 components of this framework are shown on the screen. So the very first step would be to be very clear on the purpose and the scope, how that information would be used and who should be involved. The second step would be working ideally alongside a consulting agency to gather and assess valid and reliable data from a variety of sources. Third would be to analyze and interpret that data and the information collected. And this would be both qualitative and quantitative data and analyzed to determine health needs. And finally, to provide the evidence needed to inform decision makers involved in developing and implementing regional health plans. Next slide, please. So some of the key questions that you might want to consider when developing a regional health needs assessment are shown here on the screen. Things such as what are the major health needs and issues facing a community, what health issues are not being addressed as well as they could be, what resources and strengths do communities have in place already for promoting wellness and addressing health issues, and how does the community use health services? For example, what, where, and for what purpose? Next slide. Some additional questions. What are the barriers and challenges? We talk about that a lot at the hospital district. What are those challenges to health faced by a particular community? What are the top priorities and what are some of the possible solutions? Next slide. So as part of our research, we looked at some BC-based examples of health needs assessments that have been conducted. And as you can probably imagine, the scope can be quite variable. In the first case that we looked at was for Salt Spring Island, which is obviously a very small community. And this survey was developed by Wave Consulting in conjunction with a 21-member advisory group consisting of Salt Spring Island residents. The final report is an analysis of the data collected between May 6th and June 3rd of 2019, so a relatively short time frame, using online and paper surveys. The whole process took about 9 months. They did interviews and focus groups of over 560 islanders aged 15 and older, and the total cost of that project was $12,500. It was paid for by a grant from the regional district and donations. However, it's important to note that this advisory group did most of the work. They advertised the survey, they distributed the surveys, they compiled all of the data. They also employed the use of high school students and some volunteers to enter information into the software. Next slide, please. These were the main areas that Salt Spring looked at for their health needs assessment. They looked at social determinants of health and access to services. The 5 social determinants of health that were explored were housing, food, I can't see on the screen there, connections, financial stress, and self-determination. And then there was also this access to health services. So you can see there was quite a range of different types of services that they looked at. Next slide. The next case study that we looked at was with what was then known as the District of Mission. This community health plan was done in 2009. Again, it was for a single community. It had a longer time frame. It was about 8 months or 18 months, and the cost was around $200,000. This particular project was a collaborative one, and it was led by independent consultants from PricewaterhouseCoopers. They were contracted through Fraser Health Authority and reported to a project steering committee. And that process and steering committee were supported by a team and a part-time local project manager. Next slide. A lot of information on this slide, but just at a high level, there were some objectives of this particular study. It was to assess the health-related needs of mission area residents and to document the current services available and identify potential future investments required to close any gaps between needs and services. Next slide. In this study, residents were asked to identify the 3 most important health-related issues that were important to them. Questions were focused on the services that were provided to individual population groups, for example, mothers, babies, children, youth, seniors, and the perceived quality of those services. They were also asked for their opinions on the ways healthcare services could be improved, and demographic information was collected. Next slide. So it's my understanding that Fraser Health Authority is currently working on what you might call a similar type of project. They're working on a clinical service plan. There was an RFP that was posted late last year for this project. And this plan will reflect the current and anticipated future service needs for the Fraser Health region. It includes acute care, community-based care, virtual services, prevention, and health promotion. Next slide. Many of you that sat on our board or have been involved in the community in the last 10 years may recall the My Health, My Community survey. It was a 2013 partnership between BCH, Fraser Health Authority, and UBC, and it collected baseline data for the ongoing health and well-being of communities and provided data for decision makers. My understanding is that a second survey was scheduled to launch in 2020. I expect that those plans were delayed due to the COVID pandemic. Next slide. So where does that leave the hospital district? So obviously Fraser Health is already undergoing some projects of this nature. The hospital district board could consider issuing a request for expressions of interest to see exactly what kind of cost range we would be looking at to do a regional health needs assessment for Fraser East. I think the board should anticipate, the working group should anticipate at least $200,000, given that the mission study was in that range. I don't expect that adding a few communities is going to exponentially increase that price, but I would think that what had been discussed previously was in the scale and scope of the mission study in 2009. This would likely be something that the working group and the board would have to put forward to the 2023 budget process, and should work probably pretty closely with Fraser Health Authority just to make sure that we're not duplicating effort. And so with that, Madam Chair, I will leave it with the working group to discuss. I'm happy to answer questions where I'm able.
Thank you. Questions? Does anyone have questions? Director Popov.
Okay, so this isn't directly tied into the rebuild of the said building that we're kind of working on. This is a regional from the outside looking in. Okay. Now, does this affect the new build if that ever gets off the ground?
Through the chair to Director Popov, my understanding is that the genesis of this request came from a desire for the hospital district board to be working more globally with Fraser Health about that strategic planning process of understanding all of the health needs of all of the communities and making sure that that Fraser East was being taken into consideration appropriately. So the suggestion was that we could do this regional health needs assessment as a means to provide data and information to Fraser Health Authority. We obviously, this is not work that the regional hospital district has in-house, so it would be something that we would have to contract out. And it's work that wasn't necessarily contemplated for 2022. So really, it's just a decision of whether this is something that the hospital district wants to engage in. Knowing that there is similar work already happening with the health authority, that's not to say that you couldn't go ahead and do this kind of work, but I guess what I would hope is that we would be working somewhat closely together just to make sure that we're not just duplicating effort and ending up with the same results.
Anyone else? Director Ross.
Sorry, was that me or Director Rob? You were calling on me?
Yes.
Okay. Yeah, well, I guess it's a lot of money, and if we don't need to spend it, I would rather not. So I guess I think I would prefer, since the province is doing this, or Fraser Health is anyway, why don't we wait and see what they come up with? And if for some reason we don't have faith in it, or we see that there are things that are completely unrealistic in there, is it too, I guess my question would be, would it be too late at that time to then conduct our own to compare?
Ms. Kinnaman.
Through the chair to Director Ross, you know, as luck would have it, we do have a representative from Fraser Health on the line today. And I think that over the last year to 2 years, Mr. Crucial and I have been working quite closely together on a number of things. And I think that certainly we could continue to have this dialogue, and he and I will keep in touch on how those projects are going. And if the information that is being gleaned from this work is not meeting the board's needs, we could then certainly approach a different angle at that juncture.
Thanks, I appreciate it. For me personally, I think that's the best route to go.
Director Stobart.
Thank you, Madam Chair. Just a couple quick questions, staff. One, was there any timeline associated with the Fraser Health initiative? And two, the other question is, I'm just wondering about the alignment of all the, I know there's a number of First Nations initiatives in healthcare that are ongoing and underway right now, which will provide, certainly provide some aspects of healthcare to those not or non-First Nations people as well. And I would just hope that there would be an alignment and those things would be taken into consideration as well with Fraser Health.
Through the chair to Director Stobart, my understanding is that the capital services planning project, while not a regional health needs assessment from the definition that I understand it to be from this board's perspective, is expected to be completed this year. So in the coming months. And in terms of liaising with First Nation Health Authority and other projects, certainly if it's the board's direction that you would like me to spend some time in researching that and bringing back reports in conjunction with that, I'd be happy to do so.
From my perspective, if that other report is coming out this year, I think again, as Director Ross said, see what's actually in it before we get carried away.
Director Dickey.
Thank you, Madam Chair, and perhaps building on what Director Ross addressed, something I always find in dealing with health district issues is the sense that I'm so totally unqualified to be involved in this work. It's such specialized discipline, and so much of the time I find myself just relying on what the health authority is advising. So I think for ourselves to become educated in this area is going to require a very big time commitment, certainly on my side. I also wonder, in the past, we've looked to the health authority to guide us through this process, and I wonder about what we're thinking about taking on here. So those are my thoughts. Thank you.
Thank you, Director Dickey. For me, I also am following up a little bit with Director Ross and wondering if we aren't working already towards a closer working relationship with Fraser Health. And we are on the hospital side of the healthcare system, and this is a big topic that would include the public health side, and we may be getting into something that we aren't qualified to be determining, and we do hopefully work towards a closer connection with Fraser Health, and that they will bring us information that we require to make good decisions.
Thank you, Madam Chair. So if we could just close this item off, typically what happens is the working group reports out to the board. So at the upcoming board meeting, perhaps the working group will want to make a recommendation to the full board on this item.
Thank you. I think, do you need a motion to that effect, or would it be just direction?
I think in this case, it might be helpful to have a motion since there was an original motion for me to bring this information forward. So perhaps a recommendation from the working group would be ideal.
Is Director Popoff moved, and is there a seconder? Director Ross, and is that a second, Director Ross? Further discussion? Those in, yes, Director Rob.
Does the motion include the budgeting or not budgeting for the money for future use, if so desired?
My understanding that the motion that was on the floor was more of a wait and see approach, that it would encourage FVRHD staff to continue to work with Fraser Health Authority on monitoring and researching the works that are already underway in terms of their strategic planning and their capital planning process. And then the board could come back at a later date if it felt that that work was unsatisfactory.
Okay, thank you. I can support that motion.
All right, then call for the vote. Those in favor of the motion? That is carried. Thank you.
Thank you, Madam Chair. So looking for a resolution to close the meeting.
Motion to close the meeting. Director Ross, Director Dickey, those in favor, contrary, carried.
Okay, if you just give us